Equine Physical Exam SOP. Take notes of your exam for the medical record. Consider using a physical exam form. Too few large animal exams are sufficiently recorded, if at all. When possible, perform a distance exam on the horse before it has been alerted or disturbed. Note the obvious. Note the character, color, consistency, and volume of any feces produced during the course of the exam. Have the horse haltered and led to the location for the physical exam to take place. Observe the horse's responses throughout. Examine its gait while being led out, led to stalks, cross ties, or just being held in place by someone. It's best not to perform this in a stall if possible, often too little room and a personal safety risk. For efficiency, decrease surrounding noise and activity or relocate to allow for a less distracted exam and more thorough auscultations in quiet. First, complete left side exam, body score, condition, temperature, then heart, lungs, and abdominal auscultation and limb examination on the left side. Second, complete the right side exam, auscultations, and limb examination. Note body condition and assign a score based on the 1 to 9 equine body condition score system, measure of subcutaneous fat. Since this involves a whole body view, followed by inspection or palpation of certain specific sites, you will be systematically assessing this horse for scoring while you move over its body performing the physical exam. From a distance, can you see the ribs or their outline?
Can't really see these and can barely feel them.
So if it's yes, the body score condition is 4 or less. If not, the body condition score is 5 or more.
This would be 5 or more.
Dr. Robinson's going to point out the areas that we look at to decide body condition score.
Over the ribs, from a distance and also close in. Also the amount of fat in the crest of the neck where the mane is anchored. Also over the withers, behind the shoulder and behind the elbow where the triceps muscles are. Over the back and rump. And then over the tail head. The largest amount of sub-Q fat on Snickers is over the rump and the tail head. Probably the least amount is over his withers. There's a little bit of fat here, not very much up here. So I would tend to call this horse a 6 out of 9 body condition score. You can see there's a dimple here, which means there's fat packed in around here. It's also a dimple right here, meaning there's fat right in here around the tail head.
Assess skin, hair, and coat throughout your exam. From a distance for a broad whole body perspective, but also while you move over its body performing the physical exam. Identify the lesions present, the pattern visible, and its distribution over the body. Examine the head. Examine the face for symmetry. The eyes for reflexes, and with a pen light for symmetry and discharge. Yep. There we go. Examine the nostrils for symmetry and discharge. The lips for sores, flaccidity, or drooling. Cheeks for symmetry and inflammation, which could be coming from the teeth or the sinuses. Ears for discharge, drooping head or head shaking, drooping ears.
Here between the mandibles on the medial side, just caudal to the facial artery. I can push up into this throat latch area and feel the 2 submandibular lymph nodes hanging down like ripe plums. They're just barely palpable, about the size of a dried apricot maybe, sliding up on the medial side of each mandible. The parotids are up here, just below the ear. Par meaning next to, otid meaning ear, par-otid. So they're up here by the ears. And they stick out just behind the ramus of the mandible. So I'm following along the ramus of the mandible and pressing in. When I feel these, they feel like the edge of a hamburger is sticking out at me. And again, they're very subtle. And then the retropharyngeals are right here behind the ramus of the mandible, right at the larynx and dorsal to it. While I'm in that area, I'll also palpate the larynx to see if I can elicit a cough. I'm doing that fairly firm right behind the larynx, between the larynx and the trachea. No cough.
The facial artery, you can feel the pulse at the edge of the mandible.
So coursing from the lateral side over to the medial side is the facial artery. Here on Snickers, that's not a very large vessel, and it's hidden even more with his thick winter undercoat. So I don't feel much of a pulse here. It's better on some horses than others. So I'll move up here to the transfacial.
Also called the transverse facial artery, ventral to the eye and facial crest.
I feel this one right here with a nice pulse in it. So here I'm taking the tongue and pulling it into his premolars and molars on one side while I run my hand up on the inside of his cheek. I put his tongue into his own molars so he won't bite on his own tongue, and therefore he won't bite on my fingers. And I can feel some points inside there. Now I'm going to check the other side. I can feel some points there also. I'd like to do that with a headlamp or with a flashlight or with an assistant to hold it or with a speculum and a flashlight. Of course, it's easier with a shorter veterinarian or a taller horse, so you can look up inside.
Examine the neck for muscular symmetry. Evaluate where you may do an injection.
So I'm going to draw a triangle here below the ligamentum nuchae, above the cervical vertebra, and cranial to the slope of the shoulder. And that defines this muscular triangle where I have an injection site for intramuscular injections, but also for sub-Q injections.
It's always fun to find a jugular pulse.
Right in this area here, below the cervical vertebra and lateral dorsal to the trachea, which I can feel here. So if I place my fingertips in the thoracic inlet, I can see the jugular furrow fill, and then as I release my fingertips, the blood is released. It's right in here. So watch the hair come up. It fills. And then I can, from that, as I push on it, I can feel the blood pressure coming down and hitting these lower fingers. And as you release these lower fingers, I can see the jugular vein empty.
The jugular pulse can be raised unspontaneously raises when the head is dropped below the level of the heart.
Down, 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 down. Here I'm going to feel for the spine of the scapula and the front edge of the scapula, just to get an idea of these superficial scapular muscles on both sides. And of course, we've already looked at the fat content when we were doing our body scoring. When we were watching the horse move initially, we may have gotten an idea of his neck flexibility.
Examine the chest, the breast, the shoulder, the withers, the back, the rib cage, and the girth. And we're examining for muscle symmetry. We're also looking for any evidence of a heave line at the costal margin of the lung fields.
No, nothing here.
We're assessing fat cover on the withers, caudal to the shoulder, over the ribs, down the back and over the tail head, in addition to the neck crest, all as part of the body condition score, which we have already gone over. When examining the hindquarters, we're looking for symmetry and musculation from both sides and rear. Tail muscle tone, resistance and motion. And we check the inguinal region and the perineum for discharge and inflammation.
So a lot of this I can't see easily without climbing down too far. So I palpate this. On this gelding, all I can feel is a fat-filled prepuce. There's no discharge or materials hanging from the prepuce. And then in the perineum, we'll pull this tail to the side. We'll see the anus. You see that there's some anal tone here, and we'll test that when we place our thermometer in the anus. Also back here, we see that there's not really any evidence of diarrhea. There's a little bit of mess here, but that's because of the rump strap on his blanket that he's been wearing in his stall. So manure catches on that and then ends up soiling in here on his buttocks, on his hocks.
Assessing the temperature safely should be done from the left side of the horse with your left hand on the horse's rump to anticipate the horse's movement or his irritation. It's often awkward and difficult to both stand safely and view the anus for insertion of the thermometer. We will not be doing thermometers at this moment, but if we were, we would advise you to lubricate the digital thermometer, shift the tail, view the anus as you insert the thermometer deeply. Hold the thermometer in place until the alarm sounds, remove, and read the temperature. A normal temperature should be between 99 and 100.5 Fahrenheit. Always note anal tone at that time. Auscultation of the heart. Listen to the heart in the left fifth intercostal space behind the elbow. 2 heart sounds are heard. Lub-dub is 1 heartbeat. The normal adult heart rate is 24 to 45 beats per minute. In a foal, it will be up to as much as 70 to 80 beats per minute. You should hear a regular rhythm with no variation with respiration. You should note any murmurs or abnormal sounds that you hear. For auscultation of the trachea and the lungs, we begin with auscultation of the trachea and palpation of the larynx to see if we can elicit a cough.
Pressing pretty firmly here.
It's a long trachea.
I'm listening over to the trachea first so I can get an idea of the background inspiratory sounds from the upper airway.
Determine the respiratory cycle by watching the rise and fall of the abdomen and flank.
So I'm watching here. Just watching as he breathes in and out, and this flank fills and then releases.
We're also going to watch the nostrils to see if there's a flare with inspiration or expiration.
So there's some nostril movement, but not very much. There's a big sigh though. That's normal. But he's not making excessive effort, demonstrative effort to breathe. Normal horse at rest is only using a small percentage of their total lung capacity, so I'm not expecting him to have to make much effort to breathe at rest. Over here, I'm able to watch the rise and fall of his abdomen in his flank as he breathes in and out, showing you the action of his intercostal muscles and his diaphragm as he makes an effort to breathe.
For auscultation of the lungs, we notice that much of the lung field is under the shoulder. So we will auscult close to and under the triceps muscle mass, as well as along the costal border and throughout the rest of the lung field. It's not unusual to hear gut sounds or borborygmi in the lung fields. It sounds like low rolls of thunder. We're going to break the lung fields into 4 quadrants for auscultation and for notation of lung sounds. Airflow in the lungs can be difficult to hear, so sometimes we will consider the use of a rebreathing bag, especially if we're concerned that a respiratory issue is present.
I'm watching his chest rise and fall. I'm usually letting him take 2 breaths before I move my stethoscope to another area. Again, with his heavy winter coat, I'm likely to hear less. It's just more insulation between his skin and the diaphragm of my stethoscope. I'm going to move back here to about the 15th intercostal space. There's our last rib. That's 18, 17, 16, 15. Usually further back from there, I get more abdominal sounds than chest sounds. And then I'm going to work my way down along his costal border here, which is about here. So I've done the margins, and now I'm going to go through the body here. First quadrant is ventral cranial. Second quadrant, cranial dorsal. Dorsal caudal. Caudal ventral.
Auscult the abdomen. Listen in the paralumbar fossa, both dorsally and ventrally, on each side of the horse. But now we'll start on the left side.
So here's your last rib, point of the hip, dorsal musculature. This paralumbar fossa is a little keyhole-sized area that gives us access to small intestine, small colon in this direction, small intestine in this direction, and potentially the pelvic flexure down in this area, kind of caudal ventral. And then here is the last rib, and here is the ventral abdomen, where we're going to listen to our this whole paralumbar fossa. Then this ventral abdomen is our flank, and that runs from this musculature of the hind leg to this last rib. Now, I can hear gut sounds through the rib cage, but not as easily because I don't have good contact with abdominal contents and skin, body wall, and my stethoscope head. So even though I might hear gut sounds over that rib cage, that's not where I'm going to focus. I'm going to focus just on abdominal wall, soft muscular abdominal wall. So abdominal wall up here in the paralumbar fossa. Most horses don't have a large enough paralumbar fossa for me to angle my stethoscope in any particular direction. So I'm just listening for sound. And there's a little thunder. And then I'm going to slide down here. I can feel a little bit of a anastomosis and tension right here of the prepubic tendon, and I'm going to slide below that down into here into the flank area. You can see I can press in on this horse pretty aggressively, get close to that pelvic flexure, and then onto these dorsal and ventral large colons. So from the right, again, we can define our paralumbar fossa in this area, slide over the prepubic tendon into the flank, and up here on the right side I've got cecum right underneath my paralumbar fossa, and then as I slide down I'm getting more cecum because it's a very large organ, and then I'm on large colon. And you can kind of feel a little bit of a difference in consistency in the abdominal wall. It's heavier down here because of the fill in the large colons. It's a little more gas and liquid filled up here in the cecum. So there's some question as to where the abdomen is and where the chest is. So remember that we've got a diaphragm that lays in here, ties in here, but it's dome-shaped. So the abdomen is pushing the diaphragm cranially and extending abdominal contents forward. So even though we will have lung reaching back into this area, just be medial to it, interior to it, we have abdominal contents extending cranial beneath that lung field. And so that's why when we listen to the chest, we might hear abdominal sounds. They're transmitting through the lung tissue and through the body wall so that we hear them. They're louder than the lung sounds, and so they show up. This abdomen, again, we know we're in the abdomen any time that we're caudal to this costal arch. And even though we might be able to hear abdominal sounds in this rib cage area, we get better contact with the abdominal organs over this muscular abdominal wall where there are no ribs, because we can press our stethoscope into that abdominal wall and up against those abdominal organs. And then we get good contact, acoustic contact, if you will, that allows us to listen to these areas. So, as a good horseman or as a good equine veterinarian, my examination of the legs of the horse began at the time of the distance examination, and I've been looking at the legs and at the gait all the way through the examination. Remember that each of these legs has four sides. There's a front and a back, a medial and a lateral, and so I'm going to, as I move around the horse, I'm going to look at each leg from each of those angles or sides. I did a lot of examination from a distance, and then looking at the legs as I moved around the horse, looking at other aspects. While I'm listening to the chest, listening to the abdomen, moving around the horse, I don't have anything else to look at, so I might as well be looking at a leg and the leg across from it. So I'm looking at the medial side of one leg and the lateral side of the other leg. While I'm lifting that tail and waiting for that thermometer to cook, and give me a temperature reading. I'm also looking at those back legs. As I move in closer, I'm actually going to run my hands down each leg. I've already looked for bilateral symmetry between the left and the right leg, and now I'm going to feel for bilateral symmetry from top to bottom. After having done my examination of the body systems of the horse, I like to do these examinations of the legs separately. I'm going to focus a lot of time on the joints and on these flexor tendons and at the condition of the hoof head along the coronary band. When I work on the back legs, I'm going to have to be more cautious. I'm going to try to get the horse to bear a little weight on that leg while I'm examining it. I can do that somewhat by shifting his weight over by pulling on his tail. Remember, we can move around the back end of the horse if we stay close and we keep watching his attitude and his activity. We've been working on this horse for half an hour already, so we're somewhat familiar with what he's going to do, but we never quite trust the horse. Checking out the knee, and then we're moving down this leg here, through the hock, down the flexor tendons, to the fetlock, pastern, and hook head. So I'm going to check these digital pulses. I can check upper ones here in the fetlock, just behind these sesamoid bones. Normally there should be no or a low pulse. Shouldn't be very high pressure. And then here, feeling for this digital pulse again, lower, which tends to be a little more on the caudal aspect. I'm going to compare those digital pulses from right to left and see whether or not there's a difference between them. Again, a strong pulse is a concern. A low pulse is a good sign. So again, these digital pulses, I'm going to find them back here, just behind these sesamoid bones in the fetlock. I can feel a little vascular bundle there of artery, nerve, and vein. And then I can slide more distal and a little more caudal and feel these digital pulses potentially in the pastern region. So I've got these dorsal metatarsal arteries also that I should be able to feel here at the splint bones, just caudal to them, between them and the suspensory ligaments and flexor tendons. Usually I can find that right about in there. Okay. So here we've got the sole and the bars, the frog sulcus or central sulcus, the lateral sulci or pericuneal sulci as Dr. Barron calls them. Hidden by the shoe are the white line and the water line. We have our heels here, here and here. We've got the toe, the quarter. So heels, quarters, toe.